Does this make sense to you? Scenario Fitting by Sceptikat, Part 11, Doubling Down on Every Mistake, narrated by Andrew Mather. The second wave, action if acting in the interest of the population, learn from policy mistakes. Learn fast from every policy mistake and correct course ahead of a possible second wave. UK government action, no change in government policy. No suggestion of managing a second wave differently. Every error is repeated. If anything, the policies are becoming more nonsensical and more harmful. Winter health crisis? Is there going to be a second wave? Some virologists don't think so, pointing out that there have been no flu-like second waves or even peaks in the countries first impacted, China, Korea, or in the winter in the southern hemisphere, New Zealand. Nor was there a second wave with SARS, another coronavirus. A leak from the Department of Health claims no one really expects a second wave or a winter health crisis because most of those vulnerable have already died. But our government's official stance is that they expect an unprecedented winter health crisis, mostly due to a second wave of the coronavirus. The initial outbreak may have caught our government unprepared. But when preparing for a possible second wave, there is time and they can use the knowledge and experience gathered to ensure that policy mistakes are not repeated. In Part 1 to 10, we have covered a spectacular list of policy mistakes by the British government with regard to the coronavirus, from forcing care homes to take in COVID-infected patients to cancelling life-saving surgeries while hospitals stood empty. As the virus has peaked and the number of casualties has declined, to a statistical rounding error, an urgent examination of the policy mistakes is surely a priority, especially if a second wave is a concern. The deaths have declined to an unremarkable level by June, and there are now only between 1 to 5 deaths a day, and even this is probably inflated as we are finding out, versus 1,700 regular deaths a day in the UK from all causes. So surely the government has had time now to reflect on its initial policy responses, especially in the face of much warranted criticism. Surely as the government considers its policy response to a possible second wave, the terrible mistakes will be avoided. Well, it seems not. In fact, it seems that anything they did badly the first time around, they're going to do it even worse the second time around. Let's go through a few examples. Initial response. Our measures have negatively affected the immune system of the population, making them more vulnerable to illness. We have not introduced any mitigating or counterbalancing measures, help or advice. Now that they have had time to reflect, let's force people to wear masks in the summer heat, even though you can count COVID fatalities on the fingers of one hand now. Any proposed action for how to protect people's immune systems better in a second wave? Silence. Initial response. More than half of the COVID deaths were in care homes, largely due to the fact that we sent infected patients there. Now that they've had time to reflect, yeah, that happened, but it wasn't our fault. Their care homes brought it on themselves. Any proposed action for how to protect the vulnerable in a second wave? Silence. Initial response. The NHS will be overwhelmed by a tsunami of COVID cases. Now that they've had time to reflect, well, hospitals may have stood empty during the first wave and we may have needed to mothball the Nightingale hospitals, but the NHS is sure to be overwhelmed by the second wave. Any proposed action for avoiding empty hospitals and dancing nurses during a second wave? Silence. Initial response. We effectively shut the NHS down, causing an untold number of deaths from lack of diagnosis and treatment of illnesses such as cancer and heart disease. Now that they've had time to reflect, we're now trialling shutting down A&E services too. Any proposed action for how to avoid causing deaths and suffering from untreated illnesses during a second wave? Silence. Initial response. We had to take drastic measures and the NHS waiting list has grown to 4 million. Now that they've had time to reflect, with the measures we will be taking, the NHS waiting list is expected to grow to 10 million. Any proposed action for how to avoid nearly tripling the already very long NHS waiting list during a second wave? Silence. Initial response. The isolation measures have caused a mental health crisis. Now that they've had time to reflect, let's introduce new measures such as masks that increase people's sense of fear and isolation. Any proposed action for how to avoid creating stress and fear and a sense of social isolation among the population now or during a second wave. Silence. Initial response: the coronavirus has a high mortality rate and this justifies extreme actions taken by the government. Now they've had time to reflect, well, evidence that the mortality rate is low, but it's best to continue with the extreme measures just in case. Any proposed action for adjusting policy to the actual level of threat in case of a second wave. Silence. Initial response: we relied on deeply flawed models and the forecast proved wildly wrong. Now that they've had time to reflect, we have used a model based on flawed mathematics for predicting the second wave. Any proposed action for how to source realistic predictions for any second wave. Silence. Initial response: the death figures have been exaggerated, creating undue fear. Now they've had time to reflect, let's predict a nightmare scenario ahead. Any proposed action for honest, level-headed communication about coronavirus deaths going forward and during a second wave. Silence. Initial response: we destroyed the economy with the lockdowns. The Bank of England is predicting the worst recession in 300 years. Now they've had time to reflect, should there be a second wave, we'll have to destroy whatever will be still left of the economy. Any proposed action for assessing the costs of any further localized or national lockdowns now or during a second wave. Silence. Initial response: the lockdown is decimating society, destroying small businesses and the middle class, disrupting our children's education. Now they've had time to reflect, that's actually great because we can reshape British society and the economy. Any proposed action for how to avoid exacerbating the devastating social consequences during a second wave. Silence. Initial response: confuse the public with unclear and contradictory rules. Now that they've had time to reflect, let's continue to introduce rules that make less and less sense. Height of pandemic: don't wear a mask, it's useless. Pandemic over, now we'll force you to wear a mask. And let's change them frequently. Introduce 14-day quarantine in time for the summer holidays, then retract 3 weeks later. Any proposed action, now that we've had time for creating a sensible, stable set of rules going forward, including for a second wave. Silence. Initial response: the government misled the public about overrun hospitals, overcounted COVID cases, misdiagnosed causes of death. Now that they've had time to reflect, threaten and silence healthcare professionals who speak out. Any proposed action for allowing open communication from frontline professionals so that their knowledge and experience can be used to plan for any second wave. Silence. Initial response: we don't see another way out of this crisis but by finding a vaccine, so we will spend untold sums of money on this. Now that they've had time to reflect, there is now research on group immunity and safe treatments, so it would appear a vaccine may be redundant. Let's push ahead with the vaccine nonetheless and suggest that we might make it mandatory. Any proposed action for exploring a path forward without vaccines and then comparing the risks, costs and benefits of this versus the vaccines ahead of a second wave. Silence. With the highest number of excess deaths, the greatest damage to the economy and every policy flying in the face of basic common sense, the UK government has done a terrible job so far. Although Matt Hancock thinks that under the circumstances they made fine decisions. So then it's not surprising that every damaging policy continues without any serious revision and new policies are introduced that are even more damaging and even less sensible. Instead of correcting past policy mistakes and charting a better course, the effort is focused on silencing critical voices. People are demanding an urgent inquiry. Boris Johnson says there will be one at some point, but this is definitely not urgent. No policy mistakes have been acknowledged, no learning from our as well as other countries' experiences to advise future policy. The policy remains: if there is a second wave, we will do the same. We go into lockdown. It is even suggested it best to stay in lockdown to prevent the second wave. There is no excuse for not making better decisions in the future. In summary, the UK government's policies with regard to the coronavirus have flown in the face of common sense and produced devastating outcomes already, yet there is no suggestion of correcting policy mistakes or managing a second wave differently. Not only are the policy mistakes continued and repeated, Any change in policy is invariably for the worse and for the more harmful and nonsensical. Sceptikat says this makes no sense. Join us for part 12, Project Fear. Thank you for watching. You can reach me, Kat Sceptikat, at sceptikat@peerlessreads.com, Andrew and Kat see it, or privately at kat@sceptikat.com.